Good afternoon to you all. I had the pleasure of chairing a very active group on policy, and we initially just had a brief discussion on what responsiveness actually meant. And for anyone to be responsive, it means there's a stimuli, and the issue was, do health and nutrition provide enough stimuli to enable agriculture to respond appropriately? Anyway, that is still work in progress. But what emerged in terms of perhaps the first priority action was that although there is a very clear food and nutrition policy, it's not well understood. The roles of the different sectors are clearly not well understood, and we see a role here for perhaps the custodian of this policy, which is OPC, the nutrition unit there, for continuing advocacy. Because the structure of this workshop is that mostly it's agriculture who's here, and if they are saying, well, the roles are not so clear, and part of the problem arose from, apparently there was a split. There used to be a food and nutrition policy, and then the nutrition part was taken off and is now under OPC. And there's a lack of clarity in terms of the institutional arrangements leading to policy incoherence. Agriculture is not quite clear what aspects of nutrition they're supposed to be implementing, given that the nutrition part went. But I also sense that maybe the way it was done, agriculture people are very smart. I'm sure they know what they're supposed to do. So maybe the way it was done did not left some souring, and maybe we need to sort that out, because how it was done has affected how agriculture maybe responds to nutrition. They're no longer sure whether, although nutrition is implied in food and nutrition security policy, but what role should they play and who's the custodian of this policy? And we think this is something that is doable easily enough, but there's a continuing role for advocacy. Because also people change. The people who were there when the policy was done are no longer there. So advocacy is not an event, it's a continuous process. And maybe this is something that needs to be done to the extent that there's a finance and economic planning unit, and it's not quite clear how this fits into the different action plans and so on. So there are good policies around, but the coherence is lacking because there's no clarity on who should do what when the policy was split. The second priority, in a way, emerges from that are the implementation modalities. It's one thing having a policy, but it needs to be operationalized and implemented. And again, the issue of who is the custodian of the policy, who you need to you see, nutrition is a cross-cutting issue, and there's need for joint planning and budgeting. Now, who does this? Apparently, OPC does this, but the timing is off. They call the sectors for this joint planning after the budget process. But I think this is something that can easily be arranged such that the joint planning of nutrition programming can be done before the budget process. And OPC also plays an advocacy role in ensuring that the different sectors are allocated the funds for nutrition programming. But when the joint planning comes after the boat has sailed off, it's a bit of a redundant exercise. And we think this is something that is easily doable. So those were the two priority actions. One, clarifying the roles and responsibilities and the issue of the policies in the different, who is the owner of the policy, of what policy. And the second one, which falls from that, is addressing the implementation modalities such that there's joint planning, joint budgeting, and also the role of the nutrition unit in OPC's clear as a coordinator and monitor and so on. If I've left anything out, my group, I'm sure, will soon put me straight, but those were the two priority actions we thought we could go with. Thanks.